Hello, my name is Fiona Wilcocks and I'm a heart failure nurse based in North East Wales. My poster presentation is titled Developing a Patient-Led Programme for Heart Failure. The programme came about because the heart failure team were noticing that patients referred back had limited understanding of their heart failure condition. As such, I researched alternative models of patient education, one such being the Chronic Disease Self-Management Programme developed by Stanford University in the 1970s for patients with arthritis, which has since been amended for many other chronic conditions. The key philosophies include teaching patients to better problem solve around their health needs. Topics discussed centre around common issues for chronic conditions such as fatigue management, building resilience and exercise tolerance, weight control, and managing low mood. Patients who have participated volunteered to be taught to lead programmes for other patients to encourage patient engagement, which also makes it a cost-effective approach. The heart failure team in East BC UHB and the self-care team collaborated to develop the first ever patient-led programme for heart failure, which has since been ratified by Stanford University, who hold the licence. The programme runs for 2.5 hours per week for 7 weeks and is attended digitally. There are 2 patient cohorts to trial the programme, one in September of this year, which is just completed, and one in January next year. There are up to 20 patients per group, and the initial groups are led by the self-care team. Evaluation includes theming of qualitative patient feedback and quantitative evaluation via 3 standard questionnaires, pre and post-programme, and at 3, 6 and 12 months. The EQ5D measures health status in 5 areas: mobility, self-care, usual activities, pain, discomfort, and anxiety, depression. UCLA score measures loneliness, and the Warwick-Edinburgh Mental Wellbeing Scale. In terms of results, 12 patients registered on the first course, 9 attended at least 1 week, and 8 completed. The issues with attendance were reported as being due to timing of the programme in the working day and problems with accessing digitally. Results were generally positive, with improvement in all quantitative scoring tools, and qualitative data was also favourable, with key themes taking back control through action planning, meeting others in similar circumstances, feeling less isolated, and becoming more responsible for their own healthcare. Initial results, therefore, were encouraging. There is planned flexibility in presentation and timing of programmes for subsequent courses, and I would argue that it is a viable option to help heart failure patients engage with and manage their healthcare needs to improve longer term outcomes. Many thanks for listening to my presentation.